Hi, so welcome to Module 2. This is the mid-face. We'll be showing you in this module the cheek augmentation, and I'll be discussing nasolabial folds as well as the marionette and tackling what is a very tricky area, which is the piriform fossa. So what is the cause of the nasolabial fold? Well, this is a symptom of a bigger problem. The bigger problem is actually a problem with the cheeks. Now, we've talked about aging in the mid-face. And as your cheeks start to lose volume in this section here, your face starts to go more anterior and more medial, so you tend to get a push forward. And you get a selective hypertrophy of a particular fat pad, which is your nasolabial fat pad. The combination of these changes creates a nasolabial fold, which sits just here and runs down the nose to the mouth, and people refer to it as nose to mouth sort of smile lines. Now, in order to treat this area, we're going to try and revolumize using either a cannula or a needle. My technique uses a bit of both. So in essence, we should know the anatomy of the area and the vasculature of the area so that we don't run into any problems. Now, if you remember the vasculature from before, your facial artery runs from your mandible and traverses up the face, and then it turns into your angular artery. But just remember that it's quite deep below the mouth and above the mouth or the corner of the mouth. It runs quite superficial. So this dictates how we will plan our treatment for the nasolabial fold. So my technique for the nasolabial fold is to use a cannula, and I tend to insert it at the sort of beyond the nasolabial fold at the very bottom, so the most inferior portion. Make a little entry with a guide needle, and it's a 25 gauge cannula, 50 millimeters, so I can get myself all the way up to the top into the piriform area. You then inject very slowly, whether it's KYSENSE defined in younger patients that are thin, or KYSENSE volume in older patients where these folds are quite significantly deeper. You then deposit as much as you need. There's no set amount, but generally I find that between half a mil to 1 mil is more than enough per side, and then give it a good massage afterwards. Now, the tricky area of the nasolabial fold is actually in this little triangular area just beside the nasal alar, and that's your piriform fossa. Now, in this area, your facial artery has traversed up, turned into the angular artery, but it's very superficial. So you can use a cannula in this area, but just be very careful and watch out for any signs of an occlusion. My technique is to actually pull the skin back, so you're pulling the artery away from this area and going 90 degrees perpendicular right through that little triangle, touching periosteum, and then depositing, it's usually about 0.2 to 0.3 mils maximum is all you need of KYSENSE Extreme. This will revolumize this little pinch point, and that will blend in nicely with the rest of your nasolabial fold.